This year with COVID, there have been a lot of challenges for our program. In the whole 27 years that I've worked for the Haven, this year has probably been the toughest. But despite all the challenges, there's been a lot of successes too. We really had to learn how to kind of do things new. We weren't used to social distancing. We weren't used to wearing masks. We had to arrange our program to make sure that we had quarantine beds and isolation beds, and then if clients got sick, that we knew what to do and that we were coordinating their medical care. And all of that was a little scary, to say the least, for staff and for clients. The clients were definitely uncertain about what was going to happen. It's hard enough to be in substance use disorder treatment, let alone have a pandemic going on out there in the world and not kind of knowing what's happening with your family. I think the hardest thing that I had to tell clients was that unfortunately their children couldn't visit for Kids Day visit. We're getting back to normal now, and so that's a great thing, and kids are able to come back into the facility. But it's hard being a mom in treatment, and it's hard to leave your kids. And so telling moms that they couldn't have those visits with their children kind of broke everyone's hearts. And being able to find ways for them to communicate with their family was really important. So we were able to get the community to rally around us. We were able to have foundations help us to get some technology and some resources and pull together so that we could do telehealth services, so that we could have moms talk to their children again. We really just want to thank the community too. Our donors pulled together and pulled resources together so that our staff could be available to care for our clients and do what they needed to instead of worrying about those small things. We have great partnerships with Sheridan Health Clinic, who did a lot of testing for our clients and took care of our clients when they were sick. But I'm so happy to report that we actually have all of our clients vaccinated now through Sheridan Health. And so that's a big thing. I was super excited the night I found out that our clients were going to be able to get vaccinated. I'm so proud of our organization, all the way from our executive director down to our support staff. Everybody has really kind of worked together and made sure that we were available for the clients. Our staff really are frontline essential workers, and they didn't miss a beat. One of the clients even told me she actually contracted COVID and was so impressed by the staff saying that, they risked themselves to help to take care of us. And that means the world to me, because that's what we kind of always strive to do with treatment, right? Is to make sure that our women feel safe and secure in their treatment. And even though COVID was uncertain, that we were able to do that during those times and our staff was able to make clients feel that way was remarkable. I know a lot of our clients suffered a little bit from depression during COVID. And as you've probably heard in the media, that the relapse rates and the mental health symptoms have gone way up because of COVID. And that's true, but clients also reported to me that during COVID that they felt like that they were grateful to be in treatment, because if they had to do that out in the community alone, that they were sure that they would have relapsed. So having that safe and secure environment of the Haven meant that they could still work on their recovery, and that meant the world to them, because being in recovery also means that they get their children back and their family back. Women in treatment face a lot of shame and guilt, especially around their children, and face a lot of barriers to coming into treatment because they have to leave their children. And I think sometimes they worry what others will think about them, and having that community support behind them and knowing that there's people out there that care about them means so much to clients and helps to keep them motivated throughout treatment. Also, the funding that we receive through community support really helps us to do extra activities with the clients and make sure that we have funding to continue the comprehensive services that we do. We are in the process of redeveloping our Haven Mother's House program, and we're really excited about that. Although we've had some funding mechanisms change, we have kind of readapted our program to better serve the community. The Haven Mother's House program used to be a year in length, and that's a really long time for moms to commit to treatment. Many of our mothers have an infant child in treatment with them, but they also have older children. And so it can be really difficult to leave those other children and come into treatment. And so this redesigned program will allow more community members to access treatment. It's a shorter length program, and it will be individualized to meet the mom's needs, but it can be up to 90 days. We're still really excited to provide trauma-informed, gender-responsive services, but also to provide services that focus on pregnant and parenting women and making sure that women are ready to re-enter the community safe, sober, and successful.